If you've heard it once from your doctor, you've probably heard it 1,000 times. Know your numbers. Blood pressure should be 120/80 or less. Your BMI should be under 25. And how about your bad cholesterol level? That should be under 100. But new guidelines released today by the American Heart Association and the American College of Cardiology say that last number isn't so important anymore. Why? They say regardless of what your numbers are, in most cases, you might need to be on a cholesterol-lowering statin drug.
The new guidelines greatly expand the number of Americans that would be eligible to receive statin drugs. We would estimate from about 36 million previously to as many as 72 million now.
So what are these new guidelines? The first two are simple. If you have heart disease, you get a statin, regardless of your cholesterol numbers. If you have diabetes, type 1 or type 2, you get a statin as well. The other two, a little bit more complicated. If you have genetically high cholesterol and your bad cholesterol is over 190, you're likely to get a prescription. And if you're between 40 and 75 and your 10-year risk of heart disease is over 7.5%, you'll get one too. Your doctors can help you figure out what your risk really is. Now, although statins do have some pretty significant side effects, including muscle pain, weakness, soreness, Dr. Nissen says the benefits clearly outweigh the risks.
The most compelling evidence is that they prevent heart attack and probably stroke as well. The drugs that we use for treating cholesterol are safe. They do have adverse effects, but the serious adverse effects are uncommon.
Dr. Nissen's take is the new guidelines are finally catching up to the latest science on just how many lives could be impacted by these medications.
Now, one thing I want to point out, I think is very important, is you could reduce the number of heart attacks and strokes, very good. But part of the reason this is there's been so much controversy is, does this actually save lives? And that may sound like a simple question, simple answer, but the data is not clear on this. It may not actually reduce that hundreds of thousands of people dying from heart disease every year. It may slow down the progression, it may make people live more functional lives, but making a dent is a lot harder.
The statin does exactly what? Just to clear up for everybody.
It is a class of medications that lower cholesterol. And the way it does it, your body's constantly making cholesterol. This sort of interferes with the mechanism of your body being able to generate cholesterol or absorb it from food.
But there are concerns about taking it for a lot of people, aren't
I mean,
there?
there are real concerns, and that gets lost sometimes in this discussion. But I can tell you, I know people who develop significant muscle cramps and aches, and that may not sound like a big deal when you talk about heart disease, but they can't be active, they can't exercise, they can't do all the other things that we doctors ask them to do. In more serious cases, that can turn into actual muscle damage. You can have liver problems as well. So, look, I mean, you got to be judicious in these things, and that's part of the reason why.